Pregnancy is an incredible journey, but it comes with its own set of challenges. From managing morning sickness to understanding what foods to eat, it's important to stay informed and take care of both your health and your baby's well-being. In today's video, we're diving into everything you need to know about pregnancy health, the common symptoms, the do's and don'ts, and how to stay healthy throughout your pregnancy. Whether you're a first-time mom or looking for helpful tips, you'll find essential advice on managing discomfort, staying active, and taking care of your body as it changes. So grab a comfy seat, and let's get started. Question 1. What should I eat during pregnancy? Answer. During pregnancy, it's essential to focus on a balanced and nutritious diet to support both you and your baby's health. Your diet should consist of a variety of whole grains, lean proteins, such as chicken, beans, and fish, healthy fats, found in avocados and nuts, and plenty of fruits and vegetables. These foods provide vital nutrients like folic acid, iron, and calcium. It's also important to drink plenty of water to stay hydrated. Try to avoid unpasteurized foods, such as certain cheeses and milk, raw seafood, and undercooked meats, as they can contain harmful bacteria or parasites that can affect your pregnancy. Discuss your specific nutritional needs with your healthcare provider to ensure you're meeting both yours and your baby's dietary requirements. Question 2. How much weight should I gain during pregnancy? Answer. Weight gain during pregnancy varies depending on your pre-pregnancy weight and other health factors. For women who started their pregnancy with a normal BMI, 18.5 to 24.9, the recommended weight gain is typically between 25 to 35 pounds. However, those who were underweight before pregnancy may need to gain more, while those who were overweight may gain less. Your healthcare provider will guide you based on your individual circumstances. It's important to focus on steady, gradual weight gain through healthy eating and regular exercise, rather than sudden jumps or losses in weight, as it can impact your health and the development of your baby. Question 3. Is it safe to exercise during pregnancy? Answer. Yes, exercising during pregnancy is not only safe for most women, but it's also encouraged. Regular physical activity can help manage your weight, improve circulation, reduce back pain, and promote better sleep. Low-impact exercises like walking, swimming, and prenatal yoga are ideal for pregnant women. It's important to avoid high-risk activities that could lead to a fall or injury, such as skiing, contact sports, or high-intensity exercises. Always consult with your doctor before starting or continuing an exercise routine to ensure it's appropriate for your health and pregnancy stage. Question 4. How often should I visit my doctor during pregnancy? Answer. Regular prenatal checkups are crucial to monitor both the health of the mother and the developing baby. During the first 28 weeks of pregnancy, visits are typically scheduled once a month. From weeks 28 to 36, you'll see your doctor every 2 weeks, and after 36 weeks, weekly visits are standard. These appointments allow your healthcare provider to track your weight, blood pressure, and the baby's growth, and to screen for any potential issues like gestational diabetes or preeclampsia. Keep in mind that if any complications arise, you may need more frequent visits. Question 5. Can I have caffeine during pregnancy? Answer. While it's safe to consume caffeine in moderation during pregnancy, it's important to limit your intake. The general recommendation is to keep your caffeine consumption under 200 to 300 milligrams per day, which is about the amount in one 12-ounce cup of coffee. Excessive caffeine can increase the risk of low birth weight, premature birth, or even miscarriage. If you're a regular caffeine drinker, consider gradually cutting back to avoid withdrawal symptoms. Keep in mind that caffeine is also found in chocolate, tea, soda, and some medications, so it's important to track your total intake from all sources. Question 6. What are common early signs of pregnancy? Answer. Early pregnancy symptoms can vary, but common signs include a missed period, fatigue, nausea, and breast tenderness. Many women also experience frequent urination, mood swings, and changes in appetite. These symptoms are caused by hormonal changes as your body begins to adapt to pregnancy. Some women may have very mild symptoms or none at all, while others may experience more intense symptoms, especially in the first trimester. If you suspect you're pregnant, it's a good idea to take a pregnancy test and schedule an appointment with your healthcare provider to confirm and begin prenatal care. Question 7. Can I travel while pregnant? Answer. Traveling during pregnancy is generally safe up until about 36 weeks, but it's important to take precautions. Air travel is usually safe, but many airlines have restrictions on flying after 28 weeks, and it may be more difficult to get comfortable during the flight. Long car trips can be tiring, so make sure to take frequent breaks and stay hydrated. If you have a high-risk pregnancy, your doctor may advise against traveling. Always check with your healthcare provider before booking a trip, especially if you have complications like gestational diabetes or high blood pressure. Question 8. Is it normal to have morning sickness? Answer. Morning sickness is very common, affecting about 70 to 80% of pregnant women. It typically occurs in the first trimester, although some women may experience it for longer. It can involve nausea, vomiting, and heightened sensitivity to smells. Morning sickness is caused by hormonal changes, particularly the increase in human chorionic gonadotropin, HCG, which helps support the pregnancy. To relieve symptoms, try eating small, frequent meals, staying hydrated, and avoiding foods or smells that trigger nausea. If vomiting becomes severe, it's important to seek medical attention, as it could indicate hyperemesis gravidarum, a more severe form of morning sickness that may require treatment. Question 9. What supplements should I take during pregnancy? Answer. Prenatal vitamins are an essential part of a healthy pregnancy. These supplements contain higher amounts of key nutrients like folic acid, iron, calcium, and DHA. Folic acid is particularly important in the early stages of pregnancy to help prevent neural tube defects. Iron helps prevent anemia, while calcium supports the development of the baby's bones and teeth. Your doctor may also recommend additional supplements if needed, especially if you have specific nutritional deficiencies. Be sure to follow your provider's recommendations and never take more than the prescribed amount of vitamins, as excessive intake of certain nutrients can have negative effects. Question 10. Can I continue taking my medications during pregnancy? Answer. Some medications are safe to take during pregnancy, but many can pose risks to both the mother and baby. Before taking any medications, including over-the-counter drugs or herbal supplements, consult with your healthcare provider. They can help you weigh the potential risks and benefits and suggest alternatives if necessary. For instance, medications like prenatal vitamins and some pain relievers, e.g., acetaminophen, are generally safe, while others, such as certain antibiotics or blood pressure medications, may require adjustments. Always check with your doctor before starting or stopping any medications during pregnancy. Question 11. What should I avoid during pregnancy? Answer. During pregnancy, you should avoid several substances and activities to reduce the risk of harm to the baby. Alcohol, no amount is considered safe, and drinking during pregnancy can cause fetal alcohol syndrome. Smoking, this can lead to premature birth, low birth weight, and developmental problems. Certain medications, many over-the-counter or prescription medications can be harmful during pregnancy, so always check with your doctor before taking any. Raw or undercooked foods, particularly meat, eggs, and seafood, as they may contain harmful bacteria or parasites. Unpasteurized dairy, these can contain Listeria bacteria, which can cause infections that may affect the baby. Caffeine, while moderate caffeine intake is generally considered safe, excessive amounts can increase the risk of miscarriage or low birth weight. Question 12. How can I reduce pregnancy discomfort like back pain or swelling? Answer. Back pain, it's common due to the growing weight of the baby, the shift in posture, and changes in hormone levels. To reduce back pain, practice good posture and avoid standing or sitting for long periods. Wear comfortable shoes with good arch support. Use a lumbar support pillow or pregnancy belt. Perform gentle stretching exercises and consider prenatal massage. Swelling, also known as edema swelling in the feet, ankles, and legs is common in later pregnancy. To manage it, elevate your feet when sitting. Drink plenty of water to help reduce retention. Avoid long periods of standing. Wear compression socks if recommended by your doctor. Question 13. What is gestational diabetes, and how is it managed? Answer: gestational diabetes is a form of diabetes that can develop during pregnancy, usually around the 24th to 28th week. It occurs when the body can't produce enough insulin to meet the increased demands of pregnancy. Symptoms are often mild or absent but can include increased thirst, frequent urination, and fatigue. It is typically managed through dietary changes, eating smaller, balanced meals, regular exercise, and, in some cases, insulin injections. Monitoring blood sugar levels regularly is crucial. If left untreated, gestational diabetes can lead to complications such as high birth weight, preterm birth, and a higher risk of type 2 diabetes later in life. Question 14. How can I manage constipation during pregnancy? Answer: constipation is common during pregnancy due to hormonal changes that relax the muscles in the digestive tract. To manage constipation: increase fiber intake by eating more whole grains, fruits, vegetables, and legumes. Drink plenty of water to stay hydrated and help soften stools. Exercise regularly, as physical activity can help stimulate bowel movement. If necessary, your doctor may recommend safe stool softeners or mild laxatives. Question 15. What is the best way to prevent stretch marks during pregnancy? Answer: stretch marks are common during pregnancy, especially as the skin stretches to accommodate a growing baby. While they may be difficult to prevent entirely, here are some tips to reduce their appearance or likelihood. Moisturize regularly using creams, oils, or lotions that contain cocoa butter, shea butter, or vitamin E. Stay hydrated to keep your skin supple. Maintain a healthy weight gain by following your doctor's guidelines to avoid rapid weight changes. Eat foods rich in vitamins C and E to support skin health. Question 16. Is it safe to have sex during pregnancy? Answer: for most women, sex during pregnancy is safe, provided there are no complications or medical concerns. However, it's essential to talk to your doctor, especially if you have a history of miscarriage, preterm labor, or bleeding. Your doctor advises against it for specific medical reasons. As pregnancy progresses, some women may feel discomfort, and positions may need to be adjusted for comfort. Question 17. What is a safe sleep position during pregnancy? Answer: as pregnancy progresses, sleeping on your left side is considered the best position for both you and your baby. This helps improve blood flow to the uterus and kidneys, reducing the risk of complications like preeclampsia. Sleeping on your back can compress the major blood vessels, which may reduce blood flow to the baby and cause discomfort or dizziness. If you feel comfortable, you can use pillows to support your body and help you maintain a side sleeping position. Question 18. Can I continue working during pregnancy? Answer: yes, most women can continue working during pregnancy, especially if they have a low-risk pregnancy. However, the type of work you do can impact how you feel during pregnancy. If your job involves standing for long periods, lifting heavy objects, or high stress, you may need to make adjustments or take breaks more frequently. It's important to listen to your body and take rest as needed. You may also consider talking to your employer about flexible work hours or additional support if needed. Question 19. What are the different types of prenatal tests, and why are they important? Answer: prenatal tests help monitor the health of both the mother and the baby throughout pregnancy. Common tests include ultrasound, used to check fetal growth, confirm due dates, and detect potential issues. Blood tests, these help identify conditions like anemia, gestational diabetes, or infections. Amniocentesis, a test for genetic disorders, done typically in the second trimester. Glucose screening, to check for gestational diabetes. Group B strep test, to screen for bacteria that could harm the baby during labor. These tests help detect potential health issues early, allowing for better management and care throughout the pregnancy. Question 20. Can I get a flu shot during pregnancy? Answer: yes, it is safe and recommended for pregnant women to get the flu vaccine. Pregnant women are at higher risk for severe illness from the flu, and the vaccine can help protect both you and your baby. It's best to get the flu shot during flu season, typically in the fall or winter months. Always consult with your healthcare provider if you have concerns about getting vaccinated.